if this is an emergency, please hang up and dial 911. If you'd like to make an appointment with your doctor, it's 3 months out, please dial 2. If you'd like to speak with your doctor, good luck with that. This is the reality for millions of Americans. They end up calling 911 just to be seen. They end up going to the hospital, and they get hospitalized with the strict visitation rules. Several days later, they end up going to a skilled nursing facility with even stricter visitation rules. Eventually, they end up going back home. They have an appointment with their doctor. That's 3 weeks out. In a week, that patient is calling back 911 and getting hospitalized again, and this cycle happens over and over again. This is rather unfortunate. This is a reality that a lot of people are living right now. This is especially true about the baby boomers. This is a population that's over 65 years old, and they have a lot of chronic medical conditions with a lot of comorbidities, or basically chronic medical conditions that stack on chronic medical conditions. And they end up getting sick and going to the hospital over and over again. We need to find a way to stop this cycle. What's the problem? How can we fix it? What is the solution? Well, the solution, let's go through it. What's missing? The doctor taking care of the patient where the patient needs to be taken care of, which is at home. There's a study from the Journal of Cancer made by University of Wisconsin that says that there are going to be 2,500 more cancer deaths, breast cancer deaths, by the year 2030. The National Institute of Cancer said that there's going to be a total of 10,000 more cancer deaths from breast and colon cancer just because people were afraid to go see their physician during this pandemic of COVID. You see, COVID placed a lot of challenges and showed that the baby boomer population was unable to go to the hospital because the hospitals were full of people because of COVID. So it showed how this overutilization of the hospitals and the rehospitalizations made it so that we can see how flawed our healthcare system is, that we're unable to take care of the population. So yes, I'm telling you that it's something that primary care physicians are really good at, which is screening for cancer, screening for breast cancer, colon cancer, lung cancer. COVID and everything that happened along with it made it so that patients are hiding at home and not going to their providers and not getting screened for these medical conditions. You see, we're talking about two different things. We're talking about the ability of someone that has their chronic medical conditions to be taken care of at home, and we're talking about basic primary care, preventative care. And both things have taken a toll during COVID. So let's talk about home-based primary care. This is a concept of basically taking care of the patients at home where they need to be taken care of. Primary care, as you know it, is when your primary care doctor sees you at a clinic. There's this team that orders all these medical tests and makes sure that you have everything you need. Home-based primary care is the idea of doing exactly the same thing at home. Well, that sounds like home health. Well, home health has a certification plan of care, which means the doctor kind of intervenes in the beginning, and then they're kind of on their own. But with home-based primary care, the doctor is always in the middle of that conversation. So let's take a look at how it would look like if you have this home-based primary care on the person that called and wasn't able to get a hold of their doctor. If this is an emergency, please please hang up and dial 911. If you would like to speak with someone, please dial 1 now. The healthcare staff takes care of the call. Doctor, my husband doesn't feel well. He's not breathing well. Ma'am, could you please take a saturometer that we left bedside at your husband, put it on his finger, and let us know what that number is? It's 89. Okay. We'll set up a telemedicine visit with your doctor right now, and then he'll be able to help you moving forward. The doctor does a telemedicine visit with the patient, sees at how the patient is breathing, looks at the vital signs that saturometer gave him, and says, and he can make several choices. He can call home health so that there's a nurse that goes to the house at that moment in time. He can send the patient to a skilled nursing facility so the patient doesn't have to go back to the hospital. But you see, there's work involved. It's not automatic. There has to be a physician leading the team and making the calls in the middle of it all so that we can save that patient from going to the emergency room and getting re-hospitalized again. So, doctor calls the patient. Ma'am, that 89 level is nothing to worry about right now. We're going to send a nurse team over within the next 15 minutes. And according to that assessment, we're going to make several decisions regarding that. In that call, in that visit with the teams, that patient can save themselves from a whole ER visit, from a whole hospital stay. So what happened in this call? What's different than the normal? Well, there was people communicating with each other. There was people talking to each other about how to take care of this patient. And the physician was actually present. You see, in the medical system, everything is run by physician orders. So nurses can't really do something without the physician actually leading the ship. That includes the hospital, it includes the drugs that you get prescribed, it includes the skilled nursing facility visits, and it even includes the home health orders. So if the home health has what they can do and something happens and it's not in that plan of action, they can't do anything with the doctor actually leading that conversation. So that's why this new approach called home-based primary care is so important. So what's stopping it? Actually, nothing is stopping it. Before, doing telemedicine visits wasn't really paid for, and that was a huge factor. But with COVID, it actually opened the doors so that telemedicine is actually paid for. This service is actually available and doable right now. It's just not been contemplated yet. It's just not been placed in action. We need to start seeing things a different way. There needs to be a paradigm shift from good old-fashioned call 911 to end up in the hospital and go through the cycle over again, to start using primary care in the home-based setting with the teams. So healthcare is pretty big, right? We're talking about hospitals. We're talking about skilled nursing facilities. We have hospices. We have home health agencies. And we have all the clinics from the primary care doctors, and we have all the specialists. Am I talking about just throwing everything away and not using all of the above? No. I'm talking about a niche way of practicing medicine that takes care of the people that need to be taken care of where they need to be taken care of. So we add home-based primary care to the rest of the wheel so that we can take care of the patients where we need to take care of them. What's another thing that's been missing? Well, it's communication. So let's talk about the end game. What would be the ideal world of medicine so that everybody's kind of happy with everything that's going on? The ideal world includes the universal medical record, where everything that they do to you everywhere is in one big medical file, and it's always shared by everyone. That's the ultimate, heaven of medical care. If they take care of you at the hospital, the doctor in the clinic always knows what they did. The specialist always knows what they did in the hospital and in the clinic. The home health always knows what they did everywhere else. But that's not what we're living in right now. And that's actually kind of dreamy, right? We are talking about how do we solve this problem with what we have right now. And it's about teams. I came and practiced medicine in a rural setting, and I was like the Lone Ranger doctor. I worked in the ER, I worked in the clinic, I worked in the hospital, I worked in the hospice, and I worked with the home health, and you felt like the one-man army team, because in rural medicine, that's usually how it goes. But when you come to a bigger place, and there's more people to take care of, that rural approach of Lone Ranger doesn't work. Primary care can't go on being a doctor with a couple of helpers. It needs to be a team, just like the skilled nursing facility is a team, just like the hospitals are a team. We need to work as a team. And then the teams need to communicate with each other. As a physician, I try to do the Lone Ranger, and I try to take care of the patients. And most of my practice is actually taking care of my patients in skilled nursing facilities, at homes, and assisted living facilities. And I was dropping the ball more than I wanted to. So I built a team. The team consists of social workers, it consists of nurses, registered nurses, practical nurses, and it consists of medical assistants. And together, we're able to communicate with other teams from the assisted living facilities, from the skilled nursing facilities, and with the hospitals so that we can take care of the patient as a whole. So it is a paradigm shift. There's a different way of doing things. There's a synchronized way of taking care of the patients. Availability by the physician and his team, and being able to communicate with everybody that needs to be communicating so we can take care of the patient where they need to be taken care of. And this is how we move forward in healthcare.